Hello friends, let us now learn about in the last class we have learned about the atelectasis and collapse and its difference from the consolidation. Okay, now if the patient, if this is just an if condition, if a patient presented with collapsed lobe, so the presentation of the patient, if there is a patient with collapsed lobe is his main presentation. Then you should see the clinical history of the patient. That is history of the patient. Now, if the patient in the history, if he is a middle-aged smoker, if a middle-aged smoker presents with collapsed lobe, if a middle-aged smoker presents with a collapsed lobe, then always the likely cause is bronchial carcinoma. Okay. Next, second, if the patient who is after surgery, actually the patient has undergone surgery, that is either the patient is in post-op state or in intensive therapy, that is, or if the patient is in an ICU. A patient of post-operative care or if the patient in ICU has developed collapsed lobe, always think that it can be due to a mucus plug or it can be due to an incorrect position of ET tube, or it can be due to incorrect position of endotracheal tube. Okay, it can be due to a mucus plug or it can be due to an incorrect position of endotracheal tube. Second, if an asthmatic patient, if a patient with asthma, with a past history of asthma, develops collapse of collapsed lobe, or if a patient with asthma presents with collapsed lobe, then it is due to a mucus plug. Because it is an obstructive disease, obviously mucus plug will be a lot. Okay, if a toddler or if a toddler or young child presents with collapsed lobe, then it is mainly due to an inhaled foreign body. If a toddler or if a young child presents with collapsed lobe, then it is due to an inhaled foreign body. Okay, so these are the different etiologies and how you can come up to a diagnosis through just collapsed lobe with a little bit of history. Now, next, types of collapse or atelectasis. So, if you see types of collapse and atelectasis, there are three different types of collapse. We have obstructive atelectasis or obstructive collapse. Then we have compressive collapse or compressive atelectasis. Then we have cicatrization collapse or cicatrization atelectasis, or if there is any adhesive collapse or adhesive atelectasis. Based on these types, we can also see. Okay. So first type is we have obstructive collapse or obstructive or resorptive atelectasis. So here, if this is the airway, these are the alveoli, these are the terminal bronchioles, and then even higher second level bronchioles. So whenever a mucus plug, either a tumor or a mucus plug or a foreign body, if either tumor, mucus plug or foreign body obstructs this airway, so obviously this airway does not have air. Slowly, see, first these alveoli, there are several alveoli. Okay, these alveoli are first filled with air, and now suddenly a mucus plug or foreign body has come and it has obstructed it, but still there is some air left in it, right? Definitely there is an obstruction, but there is an air left through it. But slowly, because of the oxygen is taken in, so slowly this air is absorbed. Okay, and slowly, if you see, this part of this lobe will become collapsed. because there is no air. The whole air which is present inside, it is absorbed into our through the capillaries. It is absorbed into our body through the capillaries. So as a result, the part of the lobe will get collapsed. So this is called as obstructive atelectasis. Then we have compressive atelectasis. Compressive atelectasis, which is also called as passive or relaxation atelectasis. In compressive or passive or relaxation atelectasis, here actually there is an extrinsic cause. Here, if this is the normal lung, it is a normal pleural space. Now, the patient has developed a pleural effusion or a pneumothorax. This pleural effusion or pneumothorax which is developed, this is pushing the lung. So, as a result, this lung has been pushed and slowly it has been collapsed. Because obviously, what does the lung contain? The lung just, it's like a sponge, right? The lung contains air just like sponge. So if this sponge, if you compress the sponge becomes small. Similarly, if you compress this lung becomes small and it becomes collapsed. So that is compressive atelectasis. This compression can be due to pleural fluid or pneumothorax or intrapulmonary space occupying lesions. Anything can compress the air filled lungs. Slowly, the air will disappear and it is compressed like a sponge into a small part which is called as collapse. Next we have cicatrization atelectasis. Cicatrization is fibrosis will occur. So that means if this is the lung, any pathology in our body which has resulted in fibrosis of this part of lung. So this, whenever there is fibrosis of that part of lung, that lobe will get collapsed, resulting in cicatrization atelectasis. This can be due to tuberculosis, radiotherapy, or pulmonary fibrosis. Next, one more type of atelectasis we have, which is called as adhesive atelectasis. This adhesive atelectasis This adhesive atelectasis is actually seen in conditions like neonatal surfactant deficiency. In neonatal surfactant deficiency or in cases of adult respiratory distress syndrome or has a complication of smoking or has complication of smoking. So all these will result in adhesive atelectasis. So these are the different types of atelectasis. Thank you.